This patient had experienced what I would call the traditional oral surgical approach to the replacement of many missing teeth, and that was attempts at complex bone grafting in order to provide her with staged implant treatment. And she experienced a wide variety of complications, which included infections, breakdown of her soft tissue wounds over her bone grafts, and ultimately, when we did our follow-up imaging for this patient, we found that we were not going to be able to proceed with the implant treatment as planned. And I reached out to Dr. Bongard and found out that we could treat her with the Chrysalis protocol. And she woke up not only with the implants that we would not have been able to place into her bone grafts, but she woke up finally with a fixed set of provisional prosthetic teeth.
Hi, I'm Dr. Julian Camastra. I'm a dentist practicing in Oshawa, Ontario, and I've been practicing for 5 years.
My name is Dr. Rafia Paracha. I'm a general dentist practicing in Oakville, Ontario for 22 years.
Well, hi, I'm Dr. Marshall Freilich. I'm an oral and maxillofacial surgeon.
My name is Cameron Jones. I graduated from McGill Dentistry in 1990. I opened Gum Doc in 1995. We used to look at an implant being successful when it integrated, right? And the integration rate in the upper jaw wasn't that great, especially in the posterior regions. You certainly weren't immediately loading it, and aesthetics were maybe a secondary.
So my first visit at Chrysalis really was an eye-opener in terms of the potential benefit of consideration for immediate placement of implants. For me, historically, that was something that I tended to avoid. I had a belief system that immediacy equaled a higher rate of failures for implants.
If one of our patients is losing a tooth, I think they'd be really, really happy with a same-day service. But we have barriers. Is it going to work? Do we have everything we need to provide that service?
I knew there was this place in Toronto where they would do, teeth in a day surgeries, and some of our tough patients that we just didn't have solutions for at the time, we would just refer them here.
Back in the day, I was probably doing that, 750 to 1,000 implants a year. So there wasn't that many people around doing those numbers. So, when I was driving here, I probably felt a little bit, well, what am I going to learn from this guy, right? I already do a ton, right?
It became easier to accept after spending some time with Chrysalis and understanding that immediacy was something they were doing day in and day out, and that if this was problematic, clearly they were not going to continue to do so. It was easy. It was easy, patient acceptance was high, and it became a very easy concept to accept for me at that point.
I was here for the morning surgery, and Dr. Bongard was extremely gracious and very welcoming, and just a teacher at heart. I just basically followed around here the whole day.
So it was a great day. Saw a bunch of surgeries. They were different. Each one was unique.
You get in a routine, you not get a bit stagnant, but you're doing the same thing over and over. I really enjoyed it. I love the patient interaction and the interaction with my colleagues and the guys I work with, referral base. But I just realized there was so much more that we could be doing, and it literally opened my eyes up.
There was a day, like a month or two later, where my assistant said to me, ever since you spent a day with Dr. Bongard, your work is different. You're more confident, you're just faster, you don't think twice.
Patients today want to come They'll arrive at a dental clinic. Conceptually, they know they'll lose a tooth, but they expect to get one back. And these are the demands that patients today, through outlets like social media, access to more information, are putting a lot of pressure on their dental professionals and practitioners and requesting these sorts of solutions.
Patients aren't looking at, did the implant integrate, how many threads are exposed. They want to know, how solid their tooth lasted, did it hurt, and how good it looks afterwards, right?
What I'm trying to do is learn ways of simplifying the process for our patients. Rather than making treatment more and more complex, is how do we make it simpler for our patients and for our teams as well to provide that care. I think the biggest barrier there, though, is just it's providers. Dentists have to change their thinking.
My practice is probably 98% dependent on direct referrals from dentists, and so if my dental referrals don't understand what we can do and make a knowledgeable referral, for me it's like swimming uphill.
There's the concepts and there's the tools, but all of us run different practices, and it's trying to visualize how that looks in my practice and with my team members.
And at the end of all of this, what we're all seeking to do is provide more implant treatments for the patients who need them.